First here at 9, Austin public health officials say they are seeing positive results treating COVID-19 patients with plasma donations from people who have had the virus.
It's a simple process, very similar to drawing blood, and more people are stepping up to donate. KXAN's Alex Caprariello reports this may be key to handling a second wave of cases.
I felt wretched for about 10 days.
A ski trip to Switzerland took a nasty turn when Jason Perkins was diagnosed with COVID-19.
Everybody's been helping me out, so if I can donate some plasma and help somebody out, then I should do that.
Perkins is now one of 110 Central Texas donors who have given plasma after they recovered. Austin Public Health's Dr. Mark Escott says it's helping reduce the amount of time patients are kept at the hospital.
So our hope is that hospital length of stay will diminish, which should put us in a better position when it comes to the need for hospital beds in the future.
We've been able to treat over 130 COVID-19 patients with convalescent plasma. Because of the huge response from the community that we're experiencing, we are now able to respond to new requests from physicians and hospitals within the same day.
Ascension, Texas hospital officials say they've treated 75 COVID-19 patients alone, but the need is still ongoing. Experts are calling for more donors to come forward in case there's a second wave and more people need to be treated.
By collecting convalescent plasma now, we'll be prepared for that moment, and we'll also be able to, in real time, continue to treat patients as they need.
Perkins says he plans to donate again as soon as possible.
If there's any chance at all that this could help people, then why not?
Alex Caprariello, KXAN News.
In order to donate, you have to have tested positive for COVID-19 and be symptom-free for at least 2 weeks. You can also return to donate again every 28 days. We've included a qualification form at our website, kxan.com. Plasma can be used for other medical treatments. According to the American Red Cross, it's commonly given to trauma, burn, and shock patients. Patients with severe liver disease or those with clotting deficiencies can benefit. Plasma can boost a person's blood volume. It can prevent shock and helps with blood clotting.